ಸುಶ್ರುತಸಂಹಿತ ಅಧ್ಯಯನ. Without further delay, I'd like to call upon Dr. Muridhar Sharma sir, STM CAODP, to take over the session. Welcome to you, sir.
The next chapter is अथातः aturopKRmNIY व्याख्यास्यामः यथोवाचं भगवान् धन्वन्तरिः. It's about the modalities of the possible treatment and then assessing the life expectancy of life of the patient so that you can identify which of the patient is fit for the treatment and which of the patient is not fit for the treatment is the main target of this chapter. Now, आतरम् उपक्रममाणेन विषय आयुः आदावेव परीक्षितव्यं. सखि आयुषि व्याधि ऋतु अग्नि वायु देह बल सत्व सात्म्य प्रकृति भेषजान् परीक्षेत. Now, whenever you try to treat a patient, before the treatment to be started, Sushruta says whether that patient can survive or not has to be decided. So survival of the patient, whether the patient can survive or whether the patient has some expected life period further or not, that needs to be assessed. And only when the patient having some expected life period, like now you can expect him to survive, then you have to go for the detailed examination of the disease, the season, Agni, Vayu, Deha, all that, the different Pariksha Bhavas, they need to be treated. So how to decide about the possible life expectancy, whether a patient can survive for a long duration or not, how to decide that? Now that's a very complex issue. To predict the life of any person is almost impossible from any of the parameters now. But still, there are certain methods by which you can, to a certain extent, guess about that. And one of the method of guessing about the possible expectancy of life would be by looking at the physique of a person. By the certain of the physics of the patient, physics in the sense total body dimensions, the proportions of the body, that could be one of the possible predictions to the expected life period. Now, Sushruta lists some of those features which can give you an idea of what could be the prediction of the prolonged or extended life period or longevity, dirghai. महापाणिपाद पार्श्वपृष्ठस्तनाग्र दर्शन दशन वदन स्कंधललाटम दीर्घ अंगुली पर्वोच्छ्वास प्रेक्षण बाहुम विस्तीर्ण भ्रूस्तनांतर उरस्कम ह्रस्व जंघा मेढ्रग्रीवम गंभीर सत्वस्वरनाभिम अनुच्चैः बद्धस्तनम उपचितम आहार उपचितम आहार रोमशकर्णम उपचित महारोमशकर्णम पश्चात् मस्तिष्कं स्नातानुरिक्तं मूर्धानुपूर्व्या विशुष्यमाण शरीरं पश्चात् च विशुष्यमाण हृदयं पुरुषं जानीयात् दीर्घायुः खलु अयम् इति. Now there are many very interesting issues in this. One is by looking at the size of the body, like the hands, the foot, the palm and the plantar surface of the body when it is bigger, and when the body shows a healthy or a bulky sides of the body, parshva, the lumbar area as well as back. The back should be strong, and the chest also is a quite wide chest, and the teeth and the face as well as the forehead, it is quite wider. The fingers are longer, and the person breathes deep breathing, uchvasa prekshana, dirghottvasam. The time taken for the breathing is longer, so naturally the total tidal volume is more. Then vistirna bhustana antaravaskam. The hair, eyebrows and the chest shapes should be very wider, whereas the jangha, the knee and the finish and the neck, they should be shorter, and who has a voice which is quite resonant and deep, a resonant voice, deep voice, which is pronounced from the nabhi, from the umbilicus area, and the person doesn't speak very loud, has a natural tendency of speaking in a mild manner. Then the ears have more hairs. Then the back side of the head skull is more prominent. When you look at the skull shape, if the posterior surface of the skull is more prominent, and when a person takes bath, if the head portion dries first and the last portion to be dried is the chest area, such a person is supposed to be dirghayu, expected life period should be longer. Now, these are certain of the things which are still controversial issues. I cannot just, from the contemporary science point of view, you do not have any method of suggesting like whether these are really true or not. Such a study is never done. तम एकान्तेन उपक्रमेत येभिः लक्षणैः विपरीतैः अल्पायुः मिश्रैः मध्यमायुः इति. Now these have to be observed very accurately, and when person who has features other than these is supposed to be alpayu, and if there are certain of the features are seen and certain of the features are not seen, then the expected life period is a madhyamayu, or the somewhat middle. Now the same is again summarized. गूढ़सन्धिशिरास्नायुः संहताङ्गः स्थिरेन्द्रियः उत्तरोत्तरसुक्षेत्रः यः दीर्घायुः उच्यते गर्भात् प्रभृति अरोगो यः शनैः समुपचीयते शरीरज्ञानविज्ञानैः स दीर्घायुः समासतः. A person whose joints and the bones are not visible to the surface, or they are covered up, and the organs are well organized, all the surface of the body are well organized, and his sensory organs are also very stable, and there is a healthy look of the person, and who doesn't have any congenital disease, as well as from the childhood itself he is having a healthy life. Such a person is supposed to be dirghayu, having a longer life. मध्यमे सायुषो ज्ञानम अथ ऊर्ध्वं निबोध में अधस्ताद अक्षयो यस्य लेखाः स्युः व्यक्तम् आयताः द्वे वा तिस्रो अधिका वापि पादौ कर्णौ च मांसरो नासाग्रम् ऊर्ध्वं च भवेत् ऊर्ध्वं लेखाश्च पृष्ठतः यस्य सुस्तस्य परम् आयुः भवति सप्ततिः. Now according to Sushruta, a dirghayu is 100 years. Dirghayu is 100 plus years as such. Madhyamayu is something around 70. So from the present days method of expected life, the maximum expected life of Indians now is 72 years. So that's the dirghayu from current parameters. Sushruta's point of view is 100 plus years as dirghayu. Now Madhyamayu, a person who can survive up to 70s, according to Sushruta, again, where you will find some lines, prominent line-like appearances below the clavicle, just subclavicular area. There will be some folds of the skin, and those folds of the skin could be either 2 or 3 or slightly more. You may see 2 or 3 folds of the skin below the clavicle. Now, folds of the skin below the clavicle suggest lesser subcutaneous fat. When there is more subcutaneous fat, the clavicle will be covered and you will not be able to see the clavicle. So possibly it could be from that point of view. Padau karnau cha mamsaram. There is a fleshy appearance, soft appearance of the plantar area and the ears. Ear cartilages also, they look to be somewhat fleshy. Nasakam urdhvam cha bhavet urdhvam. Now, the tip of the nose would be looking upwards, directed upwards. It should not be a flat nose. And the folds are seen on the back. Skin folds are seen on the back as such. And such a person would have an average life period of 70 years. जगन्यस्य आयुषज्ञानम् अथ ऊर्ध्वं निबोधमे हृत्स्वादि यस्य पर्वाणि सुमहत् चापि मेहनं तथा उरसि अवलीढानि न च तस्य न स्यात् पृष्ठम् आयतम् ऊर्ध्वं च श्रवणौ स्थानात् नासा च उच्चा शरीरिणः हसतो जल्पदौ वापि दन्तमांसं प्रदर्श्यते प्रेक्ष्यते यश्च बिभ्रान्तं स जीवेत पंचविंशतिम्. Panchavinshati or 25 years is considered to be Alpayu, according to Sushruta. 25 to 70 is somewhere in the Madhyamayu in the range, like 100 plus is the Dirghayu. Now, in the Jagannyayu, those who have a relatively healthy, lesser life expectancy, the fingers joints are shorter, whereas the penis is longer compared to the size of the finger size. the penis is longer, and the chest has, and the prusta, the back, is covered by fatty tissue. It has become covered as such, and doesn't have a flat surface. It has a round consistency. Then the ears are looking upwards, and the nose also is flatter, and nose also is having deviated or turned from the main line, like, and when a person laughs, and if his dental gums and teeth are exposed during the laughing or speaking, and whose eyes are not stable, vision is not stable, he looks at here and there, such a person is supposed to have a lesser expected life. Now, in the present day situation, in the contemporary medical point of view, this also is a question, like to predict the life is a again issue. Now, factors which are now known to be there and which affect the longevity, they are multifactorial. It's not only one. But there are these factors, among those factors which are known to have a impact on the longevity of a person, the most important are genetic and epigenetic factors, the body size, ecological factors. Now, ecological factors, where he lives and the surroundings over the area, these constitutes a major impact on the longevity of life. The other factors which also would have a very significant impact would be the lifestyle, which will include diet, nutrition, physical activity, amount of sleep, etc. Level of hygiene, like so that a person who has a hygienic personality, hygienic life, would have a better prophylaxis, as well as the medical care, whether the person can have a sufficient medical attention or not. Then the socio-economic status, level of education, social environment and social support, personality, intelligence and behavior also are now considered as the factors which can affect the longevity, and a few studies are done about each of these factors. But among each of these factors, the ones which are known to have maximum impact are the genetic and epigenetic factors, ecological factors, and the body size. These are the three factors. Now, body size having impact on the life, and the body size having impact on the total quality of life, and is studied under a separate branch which is called as anthropology. Now, anthropology is not a part of the mainstream medicine, but some factors of the anthropology still are used in the medicine. Anthropology itself is a very huge science, a separate branch of science, where you will have two factors, the biological anthropology and the applied anthropology. Applied anthropology is something which is related to the medicine, whereas the biological anthropology is totally a very huge branch. And among these, the biological anthropology again is not limited to only the human body. The biological anthropology involves the primatology and all the other animals. Human biology is one part of the biological anthropology. Out of these, now from the human point of view, the factors which are relevant from medical point of view are the biological anthropology and the cultural anthropology are the main two important factors which are related to the medical system. So medical anthropology, anthropology related to the medicine, relates to mainly biological and cultural anthropology. Others are not related to the medicine from the current point of view. Among the biological anthropology, now, certain of those factors, which are now somewhat reflections of what Sushil has said, these are known now. Now, it may not be directly said as the longevity science, but from the biological anthropology point of view, the body size or body dimensions are categorized into three categories: ectomorphs, mesomorphs, and endomorphs. The ectomorphs are who have a comparatively narrow hips and clavicles, small joints, thin built, and stringy muscle bellies and long limbs. Whereas the endomorphs would have a bit heavy, hefty body, thick rib cage, and hips are wider, shorter limbs. Now, though it's not related to the expected life period, from the point of view of the disease conditions, healthy and disease conditions, endomorphs and ectomorphs are known to have more incidence of the disease. Endomorphs are known to have more of metabolic disorders like diabetes, obesity, etc. Ectomorphs are known to have more of degenerative diseases and emaciated diseases. Mesomorphs are supposed to be a better healthy persons, and The features are wide clavicles, narrow waist, thinner joints, and long round muscle bellies. These are considered as a sign of mesomorph. So, a personality, physique of a person now is categorized into three categories: the ecto, endo, and mesomorph. And these have something relationship to, at least to a certain extent, have a relationship to what we see in the lakshanas of Prakriti. Ectomorph features are more features looking like that of a Vata Prakriti. Endomorph features more like features of Kapha Prakriti. Of course, Mesomorph, I don't say that they are the Pitta Prakriti signs, but somewhat healthy Prakriti, like Sama Prakriti features like. Now the body characters or body shapes also are decided based upon the body types, and this is not from the medical point of view. This classification is not from the medical point of view. These kinds of the body size and body dimensions are studied from the fashion industry point of view and the your business related to these garments and so on. The garment industry, these kind of issues are quite common, and in the mannequins used in the showrooms, they will show all that six types of the body types and their demonstration as such. So it may not have much of a medical value. From the medical value, the body dimensions or anthropology is related to the only those mesomorph, ectomorph, endomorph. Whereas from the fashion industry point of view, the body types are categorized into five types, and these are the typical features there. We will not go into that issue further. तथा पुनः आयुषो विज्ञानार्थम अंग प्रत्यंग प्रमाण सारान् उपदेश्यामः. Now the further details of these would be by studying the individual organs, their dimensions as such, and the sara, the next part. तत्र अंगानि अंतराधि शक्ति बाहु शिरांसि तदवयवाः प्रत्यंगानि. The word anga and pratyanga are the two important words which are again referred to in the Sharirasthana. Sharirasthana, you will have more detail about these words, anga and pratyanga. In gross, anga are the thoracic, the chest area, and the bahu, the arms and head. So that's how we decide the body. And the pratyanga are the further details like the fingers and the joints, forehead, etc., etc. तत्र स्वैः अंगुलैः पादामुष्टप्रदेशन्यो जङ्गुलायते. Now, the dimensions of the body and the proportion, the ratio of individual organs is studied based upon the dimensions of the same body. It's not the universal standard. Now, in present day situation, to measure anything, we follow a universal standard. Universal standard like a meter or a foot. Now, when we say a foot, that foot is really size of King George 2's foot, and it's that size is maintained in a museum in London, and is compared to the foot of King George. Now, whereas from Ayurvedic point of view, instead of referring to King George's foot size, we refer to the foot size or maybe any part of the body as a basic measure, and accordingly the proportion is studied. And one of the basic measure to use very popularly to study the dimension is angula. Angula, again, there is a bit of controversy, like which is the angula. But most popular definition of the angula is the dimension of two fingers held together of the hand. The width of the two fingers are held together at the hand, or of course the other way would be the size of the mid phalanx of the middle finger. Now whether this is which is the correct angle, again there will be a lot of controversy, and in many of the textbooks you will have that angular translated to the correct dimensions, like it's a 0.75 inches and so on. So but primarily the concept of angula is to have a biological measuring means, and that biological measuring means would be suitable for that particular body, which will give you a clear idea of proportion. Now this is a very unique idea of biometrics. Now biometrics is a new branch coming up, and in the present day situation biometrics are used totally in a different manner from the contemporary issues about the security software and so on. But the idea of having that biometric, where the measurement of any organ of the body based upon the cell factors, is a very unique scientific concept, and currently the current trend is now changing to that idea. Particularly, it is in relation to the dosage of the medicines. Now, in Ayurveda, when the dosage of the medicines are mentioned, it will be in the form of anguli, prasuta, prakunja, etc. Now, that anguli, prasuta, prasuta, prakunja, etc., all these are something where you can measure the exact quantity of the dose which is suitable for that person. Whereas the universal standards would not be suitable for the individual person. So this kind of an idea of deciding the dosage of a drug or medicine based upon the body dimensions of the person, so that you will have a custom made dosage schedule, is a new idea coming in the modern pharmacology. Still it's not yet established, but in future it could be. Instead of now the standard dosage schedule which we mentioned in terms of the milligrams so on, it will be gradually coming to that area where the dosage would be decided according to the specific dimensions of the body. Of course, now a few of the drugs, the dosage will be based upon either the body weight or the surface area of the body, but even simply depending upon the surface area and the body weight may not be perfect. So there are maybe in future time you will have more of these details and new parameters may come up. Now that's one of the area which is just developing very fast, and maybe you may have a lot of information coming up in that area later. Now coming back to our issue, the all measures Sushruta says the angulas or the dimensions of the finger body is considered as the standard. And in this reference, Sushruta says, Swaihi Angulehi Padangusta Pradeshinyo Byangulayate. Now, the standard measure would be Padangusta, the big toe, and Pradeshini, the little toe. They are sorry, big toe and the Pradeshini, the fingers, the middle finger of the hand, they are considered having two angulas. Now, this dimension probably may not be seen equally in normal persons. You will have a shorter big toe and a longer the middle finger. But somehow social says about this is a bit of controversy, like whether it is really true or not. Anyway, प्रदेशिन्यास्तु मध्यम अनामिका कनिष्ठिका यथोत्तरम पंचम भागहीनाः. Proportions of the fingers of the hand would be the Pradeshini, the middle finger would be the tallest, and then the Madhyama finger, and then the Anamika. Sorry, Pradeshini is the second finger, Madhyama is the middle finger, and the Anamika, the last, is fourth finger there. Kanishtika is the last finger, the short finger. Now, there should be, the dimensions would be 1/5 lesser in each side. So, Madhyama, the middle finger would be always longer, and the next, the second finger would be by 1/5 shorter. That's if it is 5 centimeters in the middle finger, it will be 4 centimeters for the longer. And then the Anamika, the fourth finger would be 3 centimeters, and the Kanishtika should be 2 centimeters. This is what a ideal size of the body is in. Probably if you see the measures of individual fingers, you may not get the same proportion. This proportion may not be seen in majority of the people now. So there is a need to review the body size of the present day situation. Chaturangulayate Panchangula Vistrute Prapada Padatare. The Prapada is the portion of the foot which comes into contact with the earth as you start with walking. That's the heel area. And the heel area should be Chaturangula, 4 angulas. Whereas Padatala, the tip of the finger, toes, which hits the floor at the end, would be Panchangula. The tip, this anterior portion of the foot will be wider, the posterior portion of the foot will be comparatively narrower, and it will be 4 angulas in the posterior and 5 angulas in the anterior surface. Pancha Chaturangula Ayata Vistruta Parshni. Parshni is the angle area, and it should be a pancha and chaturangula, either 5 or 4 angula ayata vistruta. Length is 5 angula and width is 4 angula of the parshni, the heel area. Chaturdasha angula ayata padaha. The total dimension of the foot would be Chaturdasha, 14 angulas. Chaturdasha angula parinahani pada gulpa jangha jana madhyani. The total dimensions of the pada, gulpa, jangha. From the starting from the foot to the jangha, to the knee, would be chaturanga, chaturdashangula, 14 angulas. Now, again, in the present day situation, you may not get the same dimension. According to Sushruta, if at all you have to have a body size as per Sushruta, the dimensions of the foot and the dimensions of the distance from the ankle to the knee would be same, but practically you may not see the same features in majority of the people. Now these are all the issues which need to be studied in detail and verified in the present day situation. Ashtadashangula Jangha, the total dimension of the knee starting from the floor to the knee joint is Ashtadashangula, 18 angulas. Distance from the ankle, the medial as the tibia to the knee is 14 angulas. Then Janu Paristacha Dvatimshat Angulam Ete, the point area beyond the Janga up to the Janu, the thigh is Dvatimshat, 32 angulas as a whole. Panchashat Jangayama Samo Uru, sorry, now Ete Panchashat, total the dimension of the foot leg would be total starting from the hip to the ankle would be 50 angulas. Jangahayama Samo Uru, the dimension of the Jangha would be the same dimension of diameter of the thigh as such, should be equal. The diameter of thigh would be equal to the length of the Jangha. That is, Jangha is from the ankle to the knee. Bengulani, Vrushana, Chibuka, Dashana, Nasa, Puta, Bhaga, Karnamula, Dhru, Nayanantarani. The areas of scrotum, the chin, then the teeth area, and the gum acid, Nasa Puta, the base of the nose, and the Karnamula, the pinna of the ear, and Dhru, the either eyebrows, and the shape, the distance between the two eyes would be again 2 angulas. Very interestingly, according to Sushruta, correct feature would be the dimension of the eyebrow and distance between the two eyes would be equal. But in the present day situation, if you look at this face and then if you draw a diagram in that manner, probably the face looks odd. Chaturangulani Mehana, Vadana, Antara, Nasa, Vadanantara, Nasa, Karna, Lalata, Grivotshaya, Drishyantarani. The 4 angular distension would be the dimension of the mehana, the penis. The mouth also would be having the same size of 4 angular, and the nasa, the tip, whole length of the nose would be 4 angulars, and the size of the nabhi, hridaya, griva, the size of the nabhi, umbilicus, and the thoracic area would be again the heart area, the cardiac dimension would be 4 angulars, and neck also would be 4 angular. Stanantara Mukhayamam, the Stanantara is the distance between the two nipples, again would be Mehana Nasa Karna Lalata Griva Utshaya Grivotshaya, the prominence of the neck, and Drishyantarani, dimensions between the two is pupils would be Chaturangula, 4 angulas. Dvadashangulani, Dvadasha, 12 angulas are Bhaga Vistara. Bhaga Vistara is the total dimensions of the buttocks. Then Mehana, sorry, the size there was a bit overlap over there. Mehana again at one stage Sushruta says the size would be 4 angulas, and another stage Sushruta says the size would be 12 angulas. So there is a question mark like how it is possible. Then Nabhi Hridaya Griva Starantaram Khani, the dimension between the Nabhi and the Hridaya, from the distance of the umbilicus to the thorax, and up the Hridaya, heart to the thorax, heart to the neck would be, and Stanantara, distance between the two nipples, they are supposed to be 12 angulas. Again, there is a bit of controversy overlapping. At one stage, the Stanantara distance is considered as a 8 angulas, now it's 12 angulas. So, big controversy is that they need to be again reviewed. Manibandha Prakostas Thoryani, the dimensions of the wrist and then the elbow joint, they also are supposed to be 12 angulas. इन्द्रपस्य परिणाः अंसपीठकूर्पर अन्तरायामः षोडशाङ्गुलः. The bulk of the muscles in the knee, calf muscles, and amsapita, the scapular area, and the elbow, kurpara, the elbow area, they should be Shorashangula. Chaturvimshati Angulaha Hastaha, the dimensions of the whole hand is 24 angulas. Dvatrimshati Angula Parimano Bhujau, the 32 angulas of the shoulder area, distance between the shoulder. And Dvatrimshat Parinaha Uru, the 32 angulas of the thigh is also mentioned. Manibandha Kurparantaram Shodashangula. The distance between the wrist to the elbow is Shodashangula, 16 angulas. And Talam Shatu Chaturangula Ayama Vistaram. The Hasatala, the dimensions of the palm would be Shat Chaturangula, 6 and 4 angulas, 6 in the length, 4 angulas in the width. Then Angusta Mula Pradeshini Stravana Apangantaram, Madhyama Angulyo Panchangule. 5 angulas are the distance of Angusta Mula at the thumb base of the from the thumb to the tip of the thumb. Then Pradeshini finger, the finger, the diamond, second finger there, and from the base, it's a 5 angulas. Then Shravana Apangantaram, the gap between the ear, pinna of the ear to the lateral aspect of the eye, that should be 5 angulas. Then Madhyama Angul, these, yeah, under Madhyama Angulyo Panchangule, the distance between the fingers, middle finger to the base as such in the sense up to the wrist would be 5 angulas. Then Ardha Panchangule, 5.5 angulas are Pradeshini Anamike. The Pradeshini and Anamika fingers there, that dimension would be Ardha Panchangula. That's 5.5 angulas. Sadhat Changalo Kanishta Angusto. The 3.5 angulas are the Kanishta, the last fingers, and the Angusta finger. Chaturvimshati Vistara Parinaham Mukha Grivam. The total dimensions of the Mukha and the Griva, face and the neck could be Chaturvimshati Vistara, 24 angulas. So Tribhaga Angula Vistara Nasa Puta Maryada. The 1/3 of the angula is the tip of the nose as such. Nayana Tribhaga Parinaha Tarakaha. 1/3 of the dimensions of the eye should be the dimensions of the pupil. Now that whether the pupil will be in a bright light or a dark room, again question mark. Navamaha Tarakamsho Dristihi. 1/9 of that would be the Dristi as such, the particular point where you can really see the eyes. Keshanta Mastakantaram Ekadashangulam. The distance between that's the width of the forehead, starting from the line of hairs up to the head area, it will be Ekadashangula. Mastakad avatu Keshantaha Dashangula. From the forehead to the chin would be Dashangula, 10 angulas. Karna avatu antaram Chaturdashangula. Gap between the karna and ear, pin of the ear to the chin would be Chaturdashangula, 14 angulas. Purusha Ura Pramana Vistirnam Stri Shoni. The dimension of the thorax of a male and dimensions of the buttocks of the female, they are equal. Ashtadashangula Vistaram Uraha. The chest would be Ashtadashangula, 18 angulas would be the width of the uras. Tat Pramana Purushasya Kati. The kati is the buttock of the Purusha, male, would be the same as that of the thoracic area. Savimshangulam Angulashatam Purushayamaha. The total dimensions of the whole body, width, height of the body would be Savimsham Angulashatam, 120 angulas. This is what is said. Now, from the present science point of view also, these sets of the proportions, ideal proportions are often studied, and these ideal proportions are studied and the data now available about the size as such. Now this body size which is now studied may not be from the medical point of view, but these are studied from the different aspects of predicting about the growth or so on, or maybe from the point of view of the fashion industry and so on. So the dimensions or the approaches of these would be quite huge. But as per the current knowledge, now there are many issues which do not really match with what Sushil has said. But again, we have to know, as we know in the current issues. In the current issues, the total dimensions of an infant is considered as a 4 head height. 4 times the dimensions of the head asset is a standard size. Any variation in this could be considered as an abnormality of the growth. Whereas in adult, it becomes a 7.5 head height. So the dimensions of the head would not change much, whereas the dimensions of the limbs would change as the age goes in. So initially, the total dimension of the body is 4 times that of the dimensions of the head, whereas at adult it will be 7.5 times. Now this variation in the growth as per the age is not really reflected in what Sushruta has said. So that's what I said, like there is a need to critically review what Sushruta has said. Maybe a detailed study is required. At present, I may not be able to comment exactly like what should be the optimum, but there is a need to review the whole issues. Certain of those standards, statistical analysis, which is mainly used in home care and security environments, are the height of the head, these are characters, elbow size and fingertips and their dimensions, that 7.5 dimension is usually distributed in this manner. Now, more of this study, like proportions and lots of information, you may study in Shilpa Shastra. If you read Shilpa Shastra, you will find lots of issues about the dimensions which are mentioned in Sushruta. But then again, there is a lot of difference. There is a lot of difference between what Sushruta has said and the standard Shilpa Shastra says. According to standard Shilpa Shastra, the if you take a image, if it is a 7 part of the tala, then the relative proportions are mentioned. These are all the issues again of different devalayas and so on. So when you prepare the idols of gods, these are used. Again, I will not go into the detail, but if at all there is a need to have a comparative study, the other source for the comparative study could be the Shilpa Shastra, and that needs to be studied. Anyway, we will not go beyond that. In the next part, Sushil says about the healthy life aspects. भवन्तिजातश्लोकाः पञ्चविंशे ततो वर्षे पुमान् नारीत् शोधते समत्व आगतवीर्योतौ जानीयात् कुशलोऽभिषेक. The dimensions of the body of the male and female. A male Panchavimshat, 25 years, and 16 years of age in the girl. At that stage, the dimensions of the body may be almost equal. This is what again another issue of controversy. Of course, it is now known that the rate of growth in female is slightly more than that of the male, but whether that difference is such a huge proportion, 25 years and 16 years, that's question mark. Like again, it needs to be reviewed. But according to Sushruta, these are the stages. 25 years age of a male and 16 years of age of a female is equivalent from the body dimension point of view, not the other way. So it's only from the body dimension point of view they are equivalent. देहः स्वैः अङ्गुलैः एषः यथावत् अनुकीर्तितः यथा वित्तप्रमाणेन अनेन पुमान् वा यदि अबाङ्गन दीर्घम् आयुः आप्नोति वित्तं च महदृच्छति मध्यमं मध्यमैः आयुः वित्तं हीनैः तथा अवरम्. Now, according to Sushruta, when you study the body dimensions according as per this ratio of male and female, if a person shows the signs of Dirghayu, he will live for longer duration as well as he will also become richer. Whereas Madhyama and Hina, proportionately their richness also will be lesser. So that's about the dimensions as such. The next part is about the Sara. Now, Sara is about personality. I think we will continue with this Sara in the coming session because already the time is very close to the ending. We may not be able to complete it today, so we will continue in the next session about the Sara. Right? Okay, if there are any questions, we will try to answer and then wind up today. Right? There are no questions, so we will wind up.